Throughout this pandemic, we have maintained a cautious, considered and careful approach based on Western Australia's expert health advice. We have always been guided by the Chief Health Officer, and it has served us well as we have embarked on our own unique recovery, best suited to Western Australia. Based on that health advice and the rates of local infection in the eastern states, we are now at the next step of our journey to safely transition from our hard border to a new controlled interstate border. The existing hard border exemption system will be removed and replaced with a controlled interstate border regime established on an updated nationwide health-based threshold, and it will be subject to trigger points being met. I want Western Australians to know that we would not be proceeding down this path unless we had the clear health advice to do so. The time is right, the conditions are right, and I'm very confident our controlled border arrangements strike the right balance. These are safe, steady and sensible steps. Pending latest health advice, effective from 12:01 a.m. on Saturday, November 14, Western Australia's new controlled interstate border will come into effect. However, we will be closely monitoring the situation over east, and if we need to delay this introduction of the controlled border, then we will. We are prepared to delay the introduction of the controlled border right up to the last minute. The Chief Health Officer has recommended a 14-day rolling average of less than 5 community cases in each state and territory be required before progressing to the new border controls. This threshold is currently being achieved in all jurisdictions across the country. Based on the health advice, there will be certain rules in place for states and territories, all depending on their level of risk. Just like we have done previously, like moving exempt Victorian arrivals into hotel quarantine, or when we needed to significantly reduce the number of exemptions available for New South Wales arrivals. From November 14, travellers from all states and territories that are deemed very low risk, that is, no local cases in the previous 28 days, will be permitted to enter WA if they comply with the following conditions. All Perth Airport arrivals will undergo a health screening and temperature test on arrival. They will need to be prepared to take a COVID-19 test at a newly established Perth Airport COVID clinic if deemed necessary by a health clinician. Voluntary asymptomatic testing will also be available for all Perth Airport arrivals if they choose to do so. Arrivals will need to complete a G2G pass declaration, stipulating that they do not have any COVID-19 symptoms and which jurisdictions they've been into in the previous 14 days. All travellers will also receive an SMS health check reminder 1 week into their stay in WA, reminding them to get tested if they have any symptoms. For arrivals by land, they will be met at the border checkpoint for health screening and to have their G2G pass declaration verified. If necessary, they will be referred for COVID testing. The very low-risk jurisdictions currently include Tasmania, Queensland, South Australia, ACT and the Northern Territory. All travellers from states and territories that are deemed low risk, which is less than 5 community cases per day on a 14-day rolling average, will also be permitted to enter WA and will need to comply with all of the above conditions. However, they will also be required to take a COVID-19 test at the airport COVID clinic if deemed necessary by a health clinician, self-quarantine for 14 days in a suitable premise, and present for a COVID-19 test on day 11. These jurisdictions currently include New South Wales and Victoria. In effect, the existing COVID safety rules will continue for people who have recently been in New South Wales or Victoria. These conditions will be subject to a review after 4 weeks. In addition, some travellers can continue to seek an exemption from self-quarantine like truck drivers, for example, who follow a different set of border arrangements. Based on the public health advice, New South Wales and Victoria remain as a low-risk jurisdiction for now. However, when they reach 28 days of no local cases or are deemed very low risk by the Chief Health Officer, they will move into that category of border control measures.